By Dr. Abe Malkin, a practicing physician, entrepreneur, and medical director of an in-home IV hydration service. Welcome.
Hi, how are you?
I want to start, Doctor, in asking you, in light of this current flu outbreak that we're talking about in California, New York, across the country, that they're facing, is any of the current issues affecting IV fluid supply lines and production stemming from the devastation Hurricane Maria and others caused to Puerto Rico and other medical suppliers in the Caribbean last fall? Are they getting affected by this?
Yeah, certainly. There's top three IV production companies, one of them being Baxter, has most of their production capacity based out of Puerto Rico. They represent about 60% of the total IV fluid market, and they've been pretty much wiped out or drastically reduced in terms of their production capacity. Due to that, hospitals across the country are facing a shortage of IV fluids and being forced to use other methods of providing fluids to patients, whether being smaller bags of fluids or perhaps even other types of fluids other than normal saline, which would typically not be used.
The headlines on this are focusing mostly on the flu. Obviously, we have a really bad flu season this year, but how has this affected patients with long-term illnesses? There's people, who are going through cancer treatment or going through other treatment where they have immune system problems and need those IV fluids on a regular basis. They may not only need IVs, but they need certain types of infusions, and because of the effects, have been recognized as I guess the question is, what did we recognize this as a problem for months? Did we see it coming, and how do we fix that? I guess.
Yeah,
how did this happen is really the question, I guess.
Sure. So to address your first part of your question, yeah, unfortunately in hospitals what we've been seeing is, nurses being forced to push medicines to patients, whether it's antibiotics or other types of medicines that would normally be infused along with IV fluids over a longer duration of time, 30 minutes or an hour. So now they're having to be pushed with less fluids, which can sometimes be detrimental to patients. It's not an ideal situation. So it certainly is affecting patient care. In terms of your other question, whether we could have seen this problem coming, this has actually been a problem for several years now, unfortunately, both due to production capacity limitations on the part of the manufacturers, but also on part of what's called group purchasing organizations that actually distribute the fluids to the hospitals. There's been chronic shortages, and this just exacerbated an already difficult situation.
I want to ask you this, is what kind of, are there other alternatives out there to kind of help offset this shortage, and are they worthwhile, are they valid, can we rely on them, part of the kind of what we're kind of scrambling to do right now?
Mm-hmm. Yeah, good question. So, the FDA is actually fast-tracking companies that are looking to produce IV fluids, fast-tracking their applications, trying to get them into the market as quickly as possible. They've also been looking at getting companies overseas to allow them to provide IV fluids to the U.S. market. So, it's difficult for a company to start from scratch, build a facility, and produce IV fluids. It takes approximately 30 steps in the production process and up to a month to actually get the production up and running. So it's better for them to focus on getting supplies elsewhere, whether it be overseas or fast-tracking applications from smaller companies.
Well, I have two questions. One, I guess out of that is this something that we have a problem producing here in the United States, or is it simply done there for cost, like most things?
It's mainly done there for cost, but again, as I stress, it's very labor intensive to produce a sterile bag of saline. There's multiple steps they have to go through to ensure quality, make sure there's no bacteria or other infections when they create the bag. So it has to be done under very close monitoring, and it's a time and labor intensive process, which again, as most things are done outside the U.S. because labor is cheaper there.
Wow. Well, let me ask you this. Are there other areas of the medical industry besides these IV bags that are being affected by essentially these weather events last year, the hurricanes and things like that? Is there anything else we should be worried about?
Across the board, all medical supplies are pretty much produced outside the U.S. And in Puerto Rico specifically, sterile gloves, catheters, other tubing and equipment that are used in the hospital on an everyday basis. You know, hospitals have been forced to resort to other methods, to use other types of materials that they wouldn't otherwise be used. So I think across the board, you know, you'll see hospitals becoming creative about how to provide services to patients without their normal supplies that they would have on hand.
What does this say about the current status of the U.S. you know, healthcare industry? If you know, not that these storms weren't like, you know, aggressive and kind of out of nowhere. I mean, they're not out of nowhere, but you know, we saw them coming and all that. But the fact that these 3 hurricanes are so damaging our healthcare industry, what does that say about where our industry stands today?
Yeah, I mean, it's certainly, you know, dominated by a couple of big players, you know, Baxter being one of them, Hospira being another one. You know, so you're certainly seeing some large players at the top of the market that pretty much dominate the healthcare market. And then below that, you're seeing intermediaries or middlemen called group purchasing organizations that pretty much dictate who gets the supplies from those large organizations. So there's some degree of conflict there in terms of how the products are being manufactured and how they're being distributed to the hospitals and clinics that are in dire need of them. So I think that certainly needs to be evaluated. And actually, there has been some movements over the past few years to work on this. But again, whenever it comes to dealing with large organizations, you know, that have, you know, strong lobbyists, it's very difficult to change, you know, current practices.
How long? Oh, sorry. Go ahead. How long do you think this will take before we start seeing them, at least in primary caregivers or primary situations, that they will be getting their supplies? Yeah. How long do you think that'll take?
You know, the FDA is sort of under the gun right now to get these supplies to the patients. So as I mentioned, they're trying multiple efforts to get supplies to the hospitals and clinics as quickly as possible. They've estimated that within the next 4 to 6 weeks, we should see a dramatic improvement in the supply. And then over the next 4 to 6 months, likely we'll see increased production capacity, which will hit the market in several months.
Is there anything that you could recommend to, you know, average John Q. citizen, Jane Q. citizen? You know, because look, these natural disasters are not going to go anytime soon. You know, they're probably only going to get worse if you follow climate change and things like that. What can the medical industry do better to prepare and handle for situations like these, and what can, you know, average citizens do to also be prepared and better prepared for situations like this?
Yeah, certainly. I mean, the hospitals do a fairly good job of being ready for flu season, and they overstaff, you know, providers. They try to get supplies on hand, but, you know, even doubling down on those efforts could certainly be helpful on the hospital or clinic side. For individuals, you know, really getting yourself ready for flu season by getting your vaccine, making sure you're doing things to maintain your health, you know, sleeping, staying hydrated, using vitamins. You know, there are private companies that will do IV hydration. You can visit those and, you know, get yourself an immune boost so you're not at risk for getting the flu. And if you do have the flu, you know, make sure you see your doctor. Make sure you're not trying to just work through it, but you see a medical professional. Make sure you're getting the care you need.
I'll ask you, Doctor, if you, as a practitioner, as somebody who's out there in the field, what is the one thing that you would want to change if you had that magic wand? What's the one thing you'd like to change most about the industry today?
I mean, access to care is always an issue. So what happens is people, you know, have a small issue, don't end up seeing a provider, whether it's because they aren't insured, they don't have access to a provider, there's a limited number of providers out there, and then that small problem becomes a bigger problem, becomes a much more costly problem on the system. So I think if we as a community, as a country, could focus on prevention more than treating diseases once they present, that would end up helping the system quite a bit.
That's brilliant. Well, thank you so much for coming on today, Dr. Malkin. Pleasure to have you.